Screen now. Okay.
Yep, yes, perfect.
All right. So DATI, we'll kind of jump right in. I always start with just like introducing myself and other members of our team, just in case you aren't going to be working in Kent or Sussex County, you might meet some other folks. But we'll start with me. So I manage our Milford office. I kind of cover Kent and Sussex County, but I certainly bleed into Newcastle County when it's needed. My background is occupational therapy. I spent about 7 years working in the field before joining about 2 years ago here at UD. And most of my experience was with older adults. So I am a certified aging in place specialist, a certified dementia practitioner, and all OTs are good at daily living accommodations. Um, so if you're not going to be working in the Kent and Sussex area, Madeline manages our Newark office. She's really wonderful. She spent her entire career in assistive technology directly. Her background's special education, but she had a special focus on AT during her master's program. And she's really great with independent living, vision, workplace accommodations. And then we talked a little bit about communication. So we do have a communication specialist or an AAC specialist on our team. Her name's Hannah Manella. She generally works out of the Newark office, but she covers everywhere in the state. She's all over the place. Wherever we need her, she's there. But she is really, really impressive in terms of her knowledge of all the different systems that are out there and the complexities of those systems. So if you have like really detailed questions, we have someone on our team who's very, very knowledgeable about that area. All right, so what is assistive technology? It's always kind of a good place to start, make sure we all understand that term. So on the screen is the dictionary definition, but really kind of that boils down to a quick elevator pitch definition. It's anything someone with a disability might use to make their life easier. So it's going to be things that are going to help them complete a task that they might not be able to do otherwise, or potentially complete it more efficiently than they'd be able to do without the technology. The word technology often kind of gets confused. When you hear technology, you might think of high tech automatically. Certainly, there are high tech equipment, but I always like to tell people, like, don't be intimidated by the word. There's so many, like, really simple, low tech things out there that can make a big difference and don't really require a lot of training or like technical know-how. So just kind of mention there's a big spectrum of technology. It's not all those really like high tech systems out there. And then just to kind of ground us in terms of like where DATI came from, we are a State Assistive Technology Act program. So in 1998, the State AT Act was signed into law. This created a permanent funding stream for us and every other state or U.S. territory to have a program to connect individuals with assistive technology. DATI is one of these programs, so we're all federally funded. We function as nonprofits. Although we all kind of get the same general funding and structure, we don't all look the same. So in Delaware, we're housed under the University of Delaware. Some other states might be housed under state agencies, like a Division of Visually Impaired or Division of Vocational Rehab. It just kind of depends on who submitted the RFP at the time that the request was put out. Um, the big thing is because there is a option in every state and every U.S. territory. The only like inclusion criteria we have is you have to live, work, or go to school in Delaware. You have to have some connection to the state. We can't serve you if you live in Maryland because Maryland has a program. So they would be the more appropriate source there. Doesn't mean we can't advise, but that happens a lot, specifically in like Sussex County, because I know that area of Maryland, like right over the line, doesn't have quite as many resources as we do here in Sussex County, Delaware, surprisingly. So people kind of lean on us a little more in that area, and we just have to advise them for Maryland. All right, so DATI and every other state AT Act program is going to have these same core services. So big one, access to equipment through our lending library. We have two in the state, one in Milford, one in Newark. Each lending library houses over 2,000 different pieces of equipment and lots of different categories. We'll talk about those on a slide coming up. We also have a lot of equipment giveaway programs and kind of offer assistance with acquiring assistive technology. You may not be aware, really, the only assistive technology that is consistently funded through insurance is going to be communication systems because they're considered durable medical equipment. 99% of everything else that's out there generally is not covered by insurance. So that's why we try to have these creative giveaway programs, and we'll talk about some of those today as well. Um, we do certainly do a lot of training and technical assistance. That can look different depending on person and situation. I will say generally we're not doing like really in-depth multi-session trainings with folks. That would kind of be something that wouldn't be appropriate under a nonprofit model. but we do have capacity to offer trainings like that under a fee-for-service model if that was ever something that was needed. Public awareness through community events, that's what I'm doing with you guys here today, just getting out and talking. We are criminally underutilized. There's so many more people in the state that I know could benefit from our services that just aren't aware of us. So the more I can get out and talk about us, the better, just because every person we tell can maybe share that with some other folks as well. And then I mentioned a little bit earlier, we do some fee-for-service evals. Melanie, you're familiar with that process. It can look different depending on who the payer source is. So in your case, I know we're able to assist in the school setting, but we can do evaluations for the Division of Vocational Rehab for like adults or young adults that are still in college, high school, or getting ready to go into the workforce to determine what kind of equipment they might need to be successful in that environment. It We can do fee for service evaluations as like an out-of-pocket thing. That's generally not something that happens because they are costly. So usually it's going to come from some other payer source. But I won't get into a ton of detail on that today just because it's a separate like branch of our service line. All right. So you know about us, you're interested in learning about us more, you know you're having trouble with something and you don't know what to do. That's where device demonstrations come in. I always tell people you don't need to know what you're looking for. Like you don't need to tell me the tech that you're looking for. All you got to tell me is what you're having trouble doing. And then I can show you all the options that might benefit you in that specific activity or area. So that's kind of what we do with device demonstrations. It's really like a guided discovery of like a device or a group of devices that might meet a need. It's really kind of like a base level overview. We're just trying to teach you enough to be able to take it home with you and like play with it more on your own to learn. And there's no cost for this. There's no cost for most of what we do. And a lot of people think that is too good to be true or we're snake oil salesmen. I promise you it's really is free. We don't have any financial ties to any of the products we have, so we're not like incentivized to push you towards something specific. Our main motivation is to find what's right for you so you're not going to spend your money on something that doesn't help you.
Anthony, can I see a question before we
Yeah,
jump off that slide?
absolutely. Oh,
So
yeah.
on the device demonstrations, are you able to like even if you don't know, what you're looking for, what if the challenges are so great you don't even know where to start? Is there a way to like come in and say, what are some of your more, like let's say common, for a school-aged child, these are some things that are generally found helpful, like because I wouldn't even know where to begin,
Yeah,
like with what we need
certainly.
help with.
That happens a lot. Like, so if you don't know what you're looking for, definitely make an appointment, come in just to learn about the service line. Sometimes just walking around the centers and seeing the different pieces of equipment will be like, oh, I didn't even know something like that could be something that would help me, or I didn't even know something like that existed. So I always recommend people, even if you're not sure, come and see us, learn about us, look around, and that might lead to some ideas. But we can certainly advise on some basic things. Like we would always ask, what are the activities you're having difficulty with? And then based on your answers, we would try to guide you towards stuff that might be a good fit for your situation. But yeah, good question there.
Thank you.
Oh, yeah. So this next slide is basically just saying that there are some limitations to device demos. One big one that I like to highlight, the last bullet point, is we're not trying to replace the expertise of like other members of someone's care team. So they might have therapy providers, they might have teachers that are really supportive, they might have individuals at your organization that are really supportive for them. We're not trying to replace anybody's expertise. We're just trying to be part of that care team, part of the puzzle to kind of find the solution to whatever the problems that are happening are. Um, the other bullets on this slide, we can do some of these things like specific instruction, assess individual abilities, and evaluate specific devices for an individual under the fee-for-service model. So that wouldn't be something we'd do as DATI because that we couldn't do it for no cost, unfortunately. But all that being said, our device demos for free are very, very detailed. You can expect to spend about an hour working with one of us if you come in for an appointment. So you get a demo of something and you really love it. What comes next? That's where our loan program comes into play. So it's free, again, no cost. It allows you to take that piece of equipment out of our controlled environment of a center and bring it to your actual environment, whether that's work, home, or school. So you can use it where you're really going to use it. This is crucial. This is so important. In a controlled environment, sometimes things feel like they're going to work really well, but then when you get into your actual environment, other environmental factors might impact the true effectiveness of that technology. So being able to actually bring it out and use it in your real environment is what differentiates us from a lot of other service providers in AT. And it's something we are really big on. It's something that's never going to go away. That's like our core kind of function is we want to loan these devices out to people so they really get a chance to try them. Device loans typically are 2 weeks. We'll generally offer an extension for another 2 weeks if nobody's asked for it. And then in specific cases, we will work with you. So like in the example of communication equipment, a lot of times trials need to happen before insurance funding gets involved. If you're using a device for a trial and you communicate that with us, I'm always willing to kind of push that extension out just to make sure that you can get what you need out of it before you have to bring it back to us. So we do work with you, but generally 2 weeks is kind of the advertised loan duration. All right, so our lending library. Here's where I say our website's not very good, so we're working on it. We just got some funding to update it, but you can certainly go on and look. If you know what you're looking for, at least a category of what you're looking for, you can certainly find things. But if you have trouble on the website, which a lot of people seem to, just get in touch with one of our staff. It's probably going to be a lot faster just to shoot us an email asking a question than to try to look on the site. Hopefully, within the next year, we'll have an updated, beautiful, accessible site, but it's not there yet. Um, so at the ATI, we break our equipment down into 7 major categories. These categories are in no way universal in AT. This is just how we define our categories. So we have equipment for vision, hearing, daily living, computer access, communication, environmental control, recreation, and leisure. There's certainly things that we have that don't fit neatly into one of those categories or things that might fit into multiple categories, but that's just kind of the 7 general main ones that we have. So now I'll talk about some equipment in each of those categories. So this slide here is vision and hearing equipment. Um, I always kind of like to, like, if I'm presenting to a group, I'll like ask if anybody wants to try to identify the picture at the bottom left. And I will say it's not a hockey puck, it's not a speaker. That is actually a bed shaker. So if you have someone who's hard of hearing and they're not able to hear an alarm, that will vibrate and shake the bed to wake them up. That can also be really helpful for hard sleepers, even if they're not hard of hearing, or maybe like a sibling situation where you share rooms with somebody. And the one sibling hears it, the other one doesn't. They're getting upset every morning. This is a way that you can have a more silent option to wake the one person up. Um, the top left and top middle are both examples of digital magnifiers, obviously of different sizes. So the top left one's going to be a lot more portable. The top middle one's going to be something that stays fixed in one location. Both options will do things like magnify, adjust contrast, change background colors, just to give you the information in a more accessible manner. The top right is an example of a listening device. So it's just a personal amplifying device. You would wear headphones with this and just kind of hold that speaker, the microphone tip out, and any conversation that's happening in the room will get amplified pretty significantly. If you don't have a hearing impairment, I always tell people start really low when you're like demoing it because it gets really, really loud. Um, and then the last thing on the bottom right is just the caption telephone. They still exist, they're just not as popular anymore. Mainly kind of still alive in the older adult world. For younger adults that might need that, they're kind of doing things that are more built into their existing tech. So, like using FaceTime instead if they needed to do sign language, or enabling live captions on a video call so that they can follow along that way. All right, so next is daily living. As an OT, that's kind of my bread and butter. But in your population, so a lot of folks with Down syndrome may have some fine motor issues that could impact some of these daily living tasks. So there's lots of equipment out there that can help. We'll start at the bottom right, which is just my favorite piece of equipment. It's the OB feeding robot. If you are able to hit 2 buttons, you can feed yourself. One button's going to toggle between those 4 little scoop areas on the plate. The other one will actually scoop the food up and bring it right to the person's mouth. So all they would need to do is bring their head forward and take a bite. Um, on the arm and the base, there's a little button that says teach. That's the only like quote unquote programming that needs to happen. You hold your thumb on each of those buttons, bring the spoon right up to the person's mouth, and then the robot learns that's the height and it'll bring it back to that identical spot every time. Bottom left is another cool one. That's called the Guyano spoon. It is basically a tremor reduction or a tremor counterbalancing spoon. So you can think about your Parkinson's population, but believe it or not, we have had some kids with Down syndrome that have like tremors or coordination issues, and they have benefited from this product. The cool thing with it is obviously it counterbalances the tremors, but it also comes with an app that provides data. So you can see like exactly how much tremors you were having during a meal. And that can be really helpful for informing you in terms of making like decisions with medications. So, hey, I took my meds an hour before my meal and look how much tremors I had. Let's try 90 minutes before, and then we can have data to back up like, oh, my tremors really did reduce during that meal time. Um, Top right's just an example of an adaptive cutting board. It's hard to see in the picture, but there's suction cups on the bottom, high sides on the back end, and then two nails that kind of poke up through that you could spear things to. It makes it easier to use for someone that has like one hand or limited use of upper body. Top Middle is a cool product if you are a caregiver of someone that maybe you're like monitoring from afar. It's called the Dose Pill Dispenser. It is a reminder that has an alarm built in. It will only open to the slot for the medication at that time, so it limits the accidental like overdosing. And if a dose is missed, whoever sets up the account will actually get a text message alert to let them know that the medication wasn't taken. So I was kind of use the example of you're caregiving for a parent. You see they missed their morning meds, you know to give them a call and kind of check in, make sure they're okay. Um, Top left is just an example of a big, long lock line straw. It's not the greatest picture, but just to show that you can adjust things and mount things so that individuals can eat and drink without having to rely on other people by putting it in a place that's accessible for them. Computer access and communication. I kind of combined these, but this is a big category specifically, well, really both categories for the population that we're talking about here today. Um, Top right picture is an example of a communication device that's actually called the eye gaze edge. At the bottom of that device, there's like a little camera. That camera will reflect off of your eyes and it allows you to just simply move your eyes around and it will control the screen. So you don't have to actually be able to physically touch or move your body any more than just your eyes. Um, that's an option for somebody who's pretty significantly impaired. If you can move your head a little bit, I wouldn't be a good option for you. And that's just one of many, many ways you can access a communication device. Most people might just use it like a tablet and they'll touch it with their fingers. But if you don't have that ability, there are other ways you can access these devices. Um, Bottom row will just kind of go right to left. So the adaptive keyboard there, it's just a wireless Bluetooth one that has a little bit of vision support with the dark, bold black letters and the white background for contrast. Um, the bottom middle is just a typing aid. So if you have difficulty with like isolating a finger to make selections on a keyboard, that can help you make those selections. Bottom left is going to be an example of an upright or ergonomic mouse for individuals who work at a desk all day. Putting your wrist in neutral position rather than straight up and down drastically reduces the risk of carpal tunnel strain and carpal tunnel injury as a result. And then top left is going to be a adaptive stylus. So again, similar to the typing aid at the bottom. If you can't isolate a finger to make selections, that can help you do it on like tablets. That one is one that's meant to be strapped to the wrist, so you really don't have to have much hand control at all with it. As long as you can move your shoulder, you can make some selections on the screen. And I think this is the last slide of this, and then I'll talk about some specific Down syndrome stuff in terms of equipment, and then we'll get into some of the giveaways. So I know it's a lot of slides. Um, Top left is an example of a contact sensor. If you have any kiddos who you are concerned with elopement, so wandering out of the house, this is a good tool to have. You can put it on any exterior doors or windows that you're concerned about, and it will give you an automatic audible alert when that door or window is open. So, oh, okay, we know they're trying to get out. Coupling that with something like the Ring doorbell cam and the bottom can be really helpful. You know the door was tripped, okay? You can't see where they went. Let's check the camera. At least we can see they went to the right, they went to the left, they went straight. So we're not just we're starting our search in a systematic way. So we kind of could see where they went to. Um, Top right is an example of an Echo Show device, so just an Amazon speaker with a front-facing camera and a screen. I like to mention that one for this population because there's a way you can monitor somebody from afar in a secretive way. It's called incognito mode, but you can watch through the front camera. So I've had families like put these in like playrooms or bedrooms, and so maybe while they're cooking meals, they can kind of keep an eye on things. But the kids still feel like they're independent. They don't know they're being watched. So it's a good way that you can kind of just check in and have that little built-in offering right in your house with technology you might already be using. Bottom left is an example of just another Amazon speaker without the screen. And then the bottom right is just to kind of highlight if you want to use smart home technology, you need to have the thing you're trying to connect it to be capable to handle Wi-Fi. Historically, there used to be like interrupters that you'd have to use, whether it was a smart plug or like something you'd screw into a light bulb. Now they're starting to make more products that actually have like Wi-Fi capability. So those light bulbs have Wi-Fi capability and can connect directly to your smart home system, and then you can control them that way. So that's just to kind of highlight some things in that area. But I did want to talk about, I kind of put some thought into what are some of the main areas that we see when families come in with children with Down syndrome, and these are kind of the big ones that we do talk about. So first one, big one is going to be AAC, augmentative and alternative communication equipment. Um, so that was like the eye gaze edge device that we showed, but there's so many other options. Just like we talked about earlier with the spectrum of technology, there's a big spectrum in this category. It can be really simple stuff like picture boards or picture exchange systems to really, really complex stuff like dedicated speech generating devices that are tablet based. Um, the augmentative and alternative part of this, like the AA part, augmentative is going to be, if you do have some verbal speech, but maybe not as much as you'd like to have, that can kind of fill in those gaps. Whereas alternative is if you don't have that verbal speech, we're replacing it with it. In either case, it can be really beneficial. And a big misnomer with AAC is people think like if you can produce some verbal speech, it's going to like inhibit your development if you introduce AAC. Research actually argues the opposite. Introducing AAC to someone who has some verbal speech, but maybe not their full language capacity, helps them develop language skills faster, and can help them transition away from devices like what we talked about a little bit earlier. Next is smart home tech. So we just talked about that, but it can be really beneficial for environmental control and also monitoring. So just checking in, making sure they're safe. Things like visual schedules can be really helpful for executive functioning needs and as well as transition. So kind of activity to activity. Sometimes kids have trouble breaking from one and going to the next. Having these visual schedules or timers can kind of help them understand when those transitions happen and make that process a little easier. Certainly a lot of sensory tools. So sensory tools can look very different. If you're a sensory seeker, maybe it's something where we're giving you things that can give you the feedback you're searching for. If you're a sensory avoider, maybe we're giving you things that can dampen the sensory experiences you're having already around you during your life that are distressing. So it can look different depending on the individual. Mobility equipment is certainly something that we get asked about. We don't carry mobility equipment, so I just want to mention that here, but we certainly are knowledgeable about it and can advise and kind of direct. But there are some places in the state that do have mobility equipment. So like Nemours would be one that we would refer people out to if it was like more significant needs. Daily living aids for self-care and activity support. We talked a little bit about that. So it can support you in a lot of different ways. Really, any activity you need to do during the day, there's probably some kind of tech that can make that task a little easier. And then lastly, much more. As you all know, everybody with Down syndrome doesn't look the same. Their needs are different, their deficit areas are different, their strengths are different. So we're not just making blanket recommendations just based on a diagnosis. We want to know what you can do and like what you're having trouble with as an individual, and that's how we're going to make your recommendations. Um, so that's kind of everything for equipment, but now we'll talk about the equipment giveaway programs, and I'll do this a little quicker. So because insurance doesn't cover a lot of equipment, we try to get creative and offer some programs that can help cover the cost for people that need it. So the first two we're going to talk about, Bold and Tobin, are both vision related. So if you have a visual impairment, you can qualify for this program potentially. Bold is one where it's going to cover things up to $100, and that's an annual max of $100. So you can take advantage of this yearly. It is not an entitlement program. It is needs based, but to be honest, we don't check anything. Like we don't have you provide any proof. This one's more of like an honor system, but essentially it will cover anything that we can argue has a vision benefit for someone that's not able to afford it up to $100. So it can be talking wristwatches, magnifiers, many other kind of simple things that can be really beneficial for people. Next is Tobin. So the two funds go together hand in hand. Tobin actually kind of pays for the Bold program. But the Tobin Fund is a lot harder to qualify for because there's no limit in terms of the cost. So this one has to be a payer of last resort. So to qualify, we would need to have proof from a vision professional about the nature and extent of the vision loss. So kind of having some medical proof. Um, you do have to get an evaluation. The good news is we can do that evaluation, so that part kind of can be taken care of by us. We do need to have proof of financial need, and we do have to have evidence of denials from other appropriate entities. So potentially like your insurance provider and maybe the Division of Visually Impaired. And if you get denials from them, then we could probably help you under this program. Next is I Can Connect. So this is another kind of sensory-based program. This is going to be for individuals who have some degree of vision loss and some degree of hearing loss. We don't need to have total blindness, total deafness, but some degree of both. Um, this one's going to cover equipment related to telecommunications. So think about like smartphones, computers, software programs, any kind of computer access equipment someone might need. And we actually are the provider for this. It's a national program. Under this one, they pay us to do an evaluation and training. This is the really the only program where we can get a lot of training time covered and reimbursed for individuals. So if they need high-tech equipment and they're not quite ready for it, it's okay because we have the time to train them. This one's one that I think your population could potentially benefit from. It does not have as many like rigid criteria. The only thing is you have to be a Highmark Health Options Medicaid member. So it's a partnership that we have with them right now where it allows us to cover equipment that insurance would not cover otherwise. So like we talked about earlier, that's basically 99% of what we have in our inventory. If you have somebody that has that insurance provider, all you got to do is get them in touch with us. We need to schedule an appointment with them. We do like a little mini assessment. If they are wanting it on behalf of their children, we definitely ask that the children are present for the appointment because it helps us justify the request. And then if we can identify things that are helpful, we will order that stuff on your behalf. It will be covered under the fund, and then you just have to come and pick it up when it comes in. It's a really unique program. There's not too many others where we can just kind of like pick things out and there's no category requirements. This one lets us cover any type of equipment as long as it benefits the individual. And the last giveaway program I'll talk about, and then we're going to wrap up right after these slides here, is the AT Exchange. I always describe it, the online version of it is like a less sketchy Facebook marketplace. It allows you to put out a want ad. So if you're looking for a specific piece of technology, you can like make a request on there. Or if you're looking to donate or sell at a reduced cost something you have, we can list it for you on the online portion. Outside of the online portion in Milford, we do have some physical items available in inventory. Our Newark office does not. They just don't have the space for it. We're a little larger in Milford, so we do have some things available. And whenever people come in, if I can identify something back there that they could benefit from, we try to connect them with it and they leave with it that day and it's theirs. So that was our giveaway programs. If you're wanting to come and see us, these are the two locations. So the first one's going to be on the university's main campus. It's actually on Wyoming Road. If you're familiar with where the Newark Library is, it's very close to that. And then our other location is where I am talking to you now from in Milford. We are the old Milford Memorial Hospital. So if you're familiar with that hospital, we are in what was the gift shop of that hospital. Um, and then the last kind of thing is questions. And then I put the contact info up here. So I'll just leave that slide on for a little bit. But do you guys have any questions after I just talked at you for so long?
Yeah, thank you, Anthony. That was great and all super useful information, hopefully for the people watching this video.
Sure.
Melanie, do you have any last questions?
Yeah, no, I agree. I've taken a lot of notes and gosh, like when you
Hmm.
were showing all of the different slides for the different categories and stuff, it kind of goes back to what I initially said of like I saw stuff there on every slide that I was like, oh, like we could
Yep.
benefit from that, but it's not something I necessarily would have like walked in there saying like, oh, help me with
Yes.
this problem or whatever. So,
Yes.
um, it would be great if you can kind of show up and then you can kind of like walk people through the highlights of,
Yep.
here's, within this category, here are some of the things that can be done, and then that'll help trigger people to be like, oh, I didn't even know that like that would be helpful, but like, yeah, that would be fabulous. So,
Exactly. Yeah. You
great.
definitely don't need to know what you're looking for before you make the appointment. You just have to basically know that there's difficulty with some type of activity, and then we can help you. We can guide you from there to figure out what might be a good fit for you. But yeah.
Right, right. Now, what about I think on one of the slides I read that like you don't do training on like the act on actual using actual devices.
Yeah.
So does that mean that like for example for my son's iPhone, like you wouldn't be able to, work with us on what the different capabilities are, or what like different apps are that could like help him for executive functioning, or
Mhm.
can you talk to
We
me
can
about
we
that?
we can certainly help in that area. So when I talk about like we don't do trainings, that's more of like multi-session trainings. Very frequently we'll have people come in, maybe they just got a new device and they want to learn how to use it or kind of learn how to set it up best for them. We can certainly help you with that. And then we can make recommendations, like you said, for apps and things to kind of support using that device in other ways. We do have the capacity to offload apps onto iPad. So if it was something that you wanted to like try before you bought, we could always like loan you an iPad with whatever educational app or communication app that we're interested in on it. So you can even try those things out as well.
Okay. And then what about like, for example, a lot of schools like the kids are using Chromebooks. But in my personal opinion, like they just seem very challenging to use. And like, are you like if you go in there and you say my child, has a school issued Chromebook, but X, Y, and Z are the problems.
Mhm.
Um, like, are you able to say, oh, well, here are some possible solutions, or here are some ideas? Like, if we brought the child's Chromebook in, you'd be able to like help us figure out.
Depends. So every kind of district does things a little differently. So sometimes they allow settings to be adjusted by like the students or the user of the device. Other times, like their IT department is the only one that can make those changes. So in those cases, we could give you suggestions on features that are built into the device that I would recommend enabling. If you
Yes,
can
that's
edit it, then
yeah.
we can do that with you. But if it's something where the device is locked, we can certainly advise and make some recommendations that could be shared with the school team.
What can you what was the wordage that you just used when you said you could give us some guidance on like how to adjust settings? What's
Sure.
that called?
The built-in accessibility settings. So like,
Accessibility.
yeah,
Yeah.
most devices will have like under their general settings, they'll have a tab for accessibility. And it's going to do things like adjust, contrast colors on the screen. It'll let you make the sizing a little larger. It can make it so that you can have things be read aloud to you, like by a simple selection. It depends on the need, but there's so many different things under that accessibility umbrella that can be tinkered with to make a device work for somebody better.
Oh, that's fabulous. So in reaching out to make an appointment, we could say, hey, could we bring in a couple of our devices from home in addition to looking through your lending library? And would you be able to like help us maximize the accessibility features on these? Okay.
Absolutely, yeah. And then if it's something where like the current device doesn't have the features that maybe would be beneficial, that's when we could loan you something that would have those features, and then that could be used to work with the school team or work with an insurance provider if it's appropriate to cover that device as like an accommodation for that student, as like an alternative access method for that student.
Sure, sure. Thank you. Is there a specific um, brand of computer or like laptop or whatever, or like iPad or something that you would recommend that's just, like where they've gone above and beyond in terms of like helping people with special needs?
I do think Apple, their built-in accessibility features are pretty incredible, and like very wide-reaching. It doesn't function beautifully yet, but how we talked about the eye gaze and how you can use your eyes, they are working on developing a way for their front-facing camera to have that technology built onto the iPads.
Wow.
They have ways where you can obviously adjust vision settings. They have ways where if you are a totally blind user, you can have everything set aloud to you. So Apple does a really, really good job at giving options for pretty much anybody that might have a need. There's mobility-based things where you can add shortcuts so you don't have to tap as many times and things like that. Lots
Does
that you
that,
can do in Apple. But Microsoft also has a pretty good accessibility team. I just think Apple's is a little bit more user-friendly to navigate and kind of play with the settings.
yeah.